Hey guys, Miss Mary here with the next video that I know you guys been waiting for it, okay? And this is client education. So let's get rolling, shall we? Okay. So let's talk about the meanings of these words. Teaching. Teaching is goal-driven and it's interactive. It involves purposeful actions to help individuals get new knowledge, change their attitudes, change their behaviors, and learn new skills. Learning is defined as the intentional gain of new information, new attitudes, new skills, and it promotes behavioral change. Motivation influences how much and how quickly a person learns. So, in other words, if you want to learn, you're going to learn. If you don't want to, you won't. The desire to learn and the ability to learn and understand content affect motivation. And information technology increases access to and delivery of all this knowledge. And of course, so does Miss Mary. So, as nurses, we provide education to individuals, families, and communities. Some of the most common factors that influence clients' educational needs are their health, their educational level, their socioeconomic status, and cultural and family influences. So, in other words, if there are certain belief systems that a patient has, sometimes it's a little more difficult to teach them. Emotional status, spiritual factors, health perception, willingness to participate, and developmental level are also things that are important to think about when you're trying to teach someone something. So you're giving clients information and skills to maintain their health, prevent illness like immunizations, lifestyle changes like diet and exercise, prenatal care, to restore their health, like self-administration of insulin, and to adapt to something that's permanent or chronic, like ostomy care, swallowing techniques, or speech therapy. Okay. And there are three domains, there are probably more than that, but the three that we're going to talk about, the domains of learning, are cognitive and affective and psychomotor. So let's start with cognitive. So cognitive learning requires intellectual behaviors and it focuses on thinking, right? It involves knowledge, which is like learning new information, understanding the new information, applying the new information, organizing the new information in a concrete way, right? And synthesizing the new information. So using that knowledge to come out with a new goal or outcome, and then evaluating, determining, was it effective? Did you learn? So here's an example. With cognitive learning, a client can learn the signs and symptoms or manifestations of hypoglycemia and then verbalize them back to the provider and say when they can notify the provider if there's something wrong. Okay, that's cognitive. Affective is about feelings and beliefs and those kinds of things. So when you hear someone talking, responding verbally, non-verbally, valuing what the person is teaching you, or believing that it's worth learning, right? These are all things, and values that you have that are consistent in decision making are characteristics of affective learning. So here's an example. Affective learning takes place when clients learn about life changes necessary for managing their diabetes and then talk about their feelings. How do they feel about having diabetes? So that's affective. Then we have psychomotor, right? That's gaining skills that require mental and physical activity. For nurses, things like, administering injections, putting in Foley catheters. So psychomotor learning relies on your perception. In other words, your awareness, your being able to see and hear, your readiness to learn, right? Your guided response, which is, in other words, performing that task with an instructor. Mechanism, which is increased confidence, which lets you learn more complex things. Adaptation, alter what you're doing if a problem pops up. And then origination, using skills to perform complex tasks that require creating new skills. Here's an example. Psychomotor learning takes place when the clients practice preparing their own insulin injections. Makes sense, right? So when you teach adult learners, you have to teach them a little differently than children, right? Because learning happens differently. Adults are able to identify usually what they need to learn, not always. And adults usually learn well by building on other information and life experiences. Adults' learning abilities are influenced by other factors. Things like employment concerns and finances might have to be resolved so the client can be ready to learn because those things could be distracting. Learning for adults is best when the nurse works with the client. And that's all about autonomy, right? To achieve your goals. When you're teaching a small group, 6 people or less, usually it's better. You can teach more than one client or family at a time, so it saves your time. And you can use different types of strategies at once. And the learners can interact and learn from each other, like I tell you guys, right? Group settings don't work for everybody. If there's some kind of a physical or emotional barrier, probably not best done in a group, probably best one-on-one. Otherwise, group settings really do work. So, assessment, data collection, evaluate the environment, identify the learning style of the learner, identify concerning areas, things like low literacy levels. Are they in pain? Are they distracted? What are your resources, financial, social, community? What is the learner's developmental level? What's their physical or cognitive ability? And do they have special needs? Like, do they have a problem with manual dexterity, or do they have any learning disabilities or challenges? And you have to figure out what their motivation is and if they're ready to learn, right? So you have to consider their culture, their personal values, how that affects their willingness to learn. And then you have to assess their ability to make health decisions by basic understanding of health and what the client believes affects health and illness. In other words, you have to assess where they are in this process before you can even try to teach them. Okay. Then you can plan, you and the patient or patients, you come up with a mutually agreeable outcome. And you prioritize what the objectives are with the client's specific needs in mind. And then you want to use methods that emphasize whatever learning style they like. Demonstrations, lectures, role playing, simulation, using visual aids like charts and graphs and images, and audio, video, those kinds of things. Make sure that you're teaching in an age appropriate way. And believe it or not, most people in this country speak and read at a 6th to 8th grade level. So make sure you're keeping it at that level, okay? Try to avoid medical terminology. And when you talk and write, do it in the second person, not the third person. So, in other words, your leg, not the leg, okay? Don't use all caps because that means you're yelling. Minimize white space and small type in print materials because it's going to be hard for them to see. When you speak to people, speak in an active voice. Instead of saying, take the medication or the medication should be taken, say, take the medication, right? You're kind of directing them. Take the medication, not you should take your medication. Give them educational resources like DVDs or CDs or anything else you have they can bring home with them. Make sure you're giving them reliable and credible information from a reliable source. Organize the activities so that you start out simple and then you move up to more complex things. Let them participate in the learning process and schedule the teaching sessions for times when learning is best. So when you're teaching ostomy care, when it's time to empty the pouch is the time to teach it, right? And that makes sense, doesn't it? Make sure the environment does not have distractions or interruptions and that it's private. You want to have active listening and empathy. That helps develop trust between you and the client. Consider their values, consider their belief systems, ask them what they know, review their previous knowledge, explain the procedure or whatever it is you're teaching, and present steps that build toward more complicated things. Have them demonstrate anything that's psychomotor and allow plenty of time for return demonstrations. Don't be in a hurry and always try to give them positive reinforcement, right? You're doing a great job. Okay. And when you're evaluating, you always use the teach back method, which works. Ask the client to explain the information in their own words. Okay. Also, observe return demonstrations if it's something psychomotor. Use a written tool to measure the accuracy of what they know, like a test. Evaluate their progress, but don't be judgmental, right? Be supportive, be encouraging. Ask the clients to self evaluate and watch for nonverbal communication, faces that they make, you know? And then anytime you follow up, reevaluate that learning. And then if you have to, you revise the care plan. Okay. You might have to go back and teach them again. There are factors that enhance learning and barriers These are things that you need to know for sure. So I'm going to highlight all of these, and then this lecture is going to be over. Okay. Things that enhance learning or make learning beneficial. Does the patient or the person that you're teaching believe there's a benefit? Do they have the cognitive and physical ability to do it? Are they actively participating? And is the information age and educationally level appropriate for them? Barriers to learning, there are endogenous and exogenous, things on the inside and things outside. Endogenous, if somebody's fearful or anxious, depressed, in pain, tired, if they have deficits like hearing problems or visual problems or psychomotor problems, then those are barriers to learning. We have to resolve those things before we can teach. And then when we talk about exogenous factors, is the room too hot? Is it too cold? Is it noisy? Are there interruptions or disturbances? Is it not private? Those are things that will stop the learning process. Make sure you know these things and make sure you understand the concepts that I talked about as far as teaching patients and how to do it. And again, as always, I'm going to leave you with this. Well, let me get rid of this slide and get to this one. There you go. Any questions? No? Okay, so then we're done. Very good. So let us be done with this, and you guys have a great day. And thanks for listening as always. Okay.